Yes, I'm just going to give you an overview about the Your Medicines, Your Health campaign, a bit of a history about it, where we are now, and then future plans. So some of you may be aware and may well have heard of Your Medicines, Your Health, and it's a campaign which aims to help people in Wales get the most out of their medicines. So the campaign was, if I try and get my slide to move on, doesn't seem to want to, there we go. The campaign was established about 10 years ago now by a pharmacist called Martin Davis, who worked in Cwmtach Morgannwg Health Board. So Martin worked in Ysbyty Cymronda, and that has lots of kind of long stay and care of the elderly wards. And what Martin was noticing was that quite often people were coming into hospital, they didn't really know what medicines they were on, or if they did know what medicines they were taking, if they knew the names of them, they didn't really know why they were taking it. He also noticed that when people were coming in, and again, they were asked to bring their current medicines into hospital with them, he noticed that lots of people were bringing in lots and lots of boxes of medicines that had been untouched. So these are medicines that should have been taken every day or twice a day, but they were coming in with lots of boxes that hadn't even been opened. So they clearly weren't taking their medicines in the way that they'd been prescribed. And Claire mentioned earlier that up to a half of medicines prescribed for long-term conditions aren't taken in the way in which the prescriber intended. So this is an area that Martin was really, really passionate about, and felt that something really needed to be done about increasing sort of the public's awareness of medicines and taking sort of responsibility for their medicines and taking a bit of ownership. So he managed to get a bit of funding from the Health Board to start the Your Medicines, Your Health campaign. So over the years, Martin has done a huge amount to raise awareness of this in Cwmtach. He's held various patient engagement events. He's linked in with community groups. He developed a lesson plan for use in schools. He got children there to design posters. Some of the posters were put onto the local health board vans going around the area. He developed lots of patient-facing materials and flyers. He's held events in the Senedd with various MSs, and he's done a huge amount to raise the profile locally. More recently, Martin's developed a website for Your Medicines, Your Health, and on the website it has all the currently available resources, a little bit about the campaign, and there's also a pledge on the website that people can sign up to sort of commit to thinking about their medicines, to using them appropriately, to taking any waste that they've got back to the pharmacy for safe disposal. So on one of the leaflets here on screen, you can see a QR code at the bottom of the screen. So if you wanted to scan that QR code, it'll take you to the website, and you can sign up to the medicines pledge. So earlier this year, Martin decided to retire. And before he retired, he really, really wanted to hand over Your Medicines, Your Health to somebody to take the reins and lead it and really take it forward. He didn't want Your Medicines, Your Health to sort of retire alongside him. And it was always Martin's ambition that Your Medicines, Your Health would become a national sort of movement, a national campaign, if you like, and it would go far beyond the bounds of sort of Cwmtach. And he always tried to do that, but wasn't really in a position to kind of take that forward. So the stars aligned, if you like, because earlier this year, the All Wales Medicine Strategy Group released their 5-year strategy. And within the strategy, there are 2 goals, which I thought really fitted in with the whole concept of Your Medicines, Your Health. And so the 2 goals are that people in Wales take their medicines in a way that maximises their health outcomes, and that waste associated with medicines use is reduced and sustainability is improved. So I thought that as AWTTC, we're a national organisation and we're working with the All Wales Medicine Strategy Group, we've got these 2 goals, that we were really in a great position to kind of take the reins of Your Medicines, Your Health, give it a bit of a refresh and an update, and roll it out across the whole of Wales. So fortunately, the rest of the senior management team here also agreed. So that's something that we're pushing ahead with, along with the national lead for the Welsh Medicines Advice Service and the All Wales Consultant Pharmacist for Community Care. The 3 of us are trying to put together a group of interested parties to kind of drive this forward. So the aim is, as Martin wanted, is to move Your Medicines, Your Health just from Cwmtach and move it to the wider population of Wales. So the way we can do this really is to develop a network of champions, if you like, champions of healthcare professionals, starting off with pharmacists and health boards, and moving across to other healthcare professionals, but also patient and public champions as well. So we're setting up a bit of a sort of strategic board to drive this forward. And what's been really fantastic is that lots of organisations that we've approached to join us in this have been really, really keen and really want to get involved. So we've got involvement from Welsh Government, Dr. Sarah Brown, who's talking to you next, and colleagues in Cardiff Met in the Health Psychology Department are also going to be involved, because it's really important that the messaging that we develop as part of this is right, that we're approaching things in the right way and the messages are going to have the right impact. So it's really important we get the health psychology experts involved. We've also got involvement from the Behavioural Insights team in Public Health Wales, because this might be about changing behaviour of some of the population in Wales who maybe aren't taking their medicines in the right way. So again, when we're looking at behaviour change and the way in which we approach that, it's vitally important that we get the experts in to help us with that and the messaging. Also really pleased to say that lots of the health boards, again, are happy to support, and they'll be integral to kind of driving this forward. So what we'll be doing is looking at the approaches that have been used previously, and trying to see if they're the most appropriate approaches to kind of go forward. As I say, Martin started this 10 years ago and he did a fantastic job, but I think that the time is right for a bit of a refresh and see if there's bit of reinvigoration, shall we say, in the campaign and the messaging and perhaps the themes. So I guess back to the crux of it, why is it important? You know, what is the issue? It's not something that's easy to tackle. It's been a problem for a really, really long time. Back in 2011, the UK government estimated that medicines waste accounted for over £300 million of waste annually. That's a huge amount, and that's a figure that was estimated over 10 years ago now. So I can imagine the figure has only gone up exponentially. And then the cost of the wasted medicines and the cost of not getting the full benefit of the medicine was estimated at £500 million a year. So these are, you know, massive numbers that we're talking about. So there's not only the cost of the medicine itself that's wasted, but the cost of the time taken by the GP practice to generate the prescription, the time taken by the community pharmacist and their team to actually clinically check and dispense the prescription. I've just mentioned the cost to people's health as well, that patients don't receive the intended benefit. They're not getting the outcomes that were anticipated when the prescriber first gave them the medication, and so they might become more ill or they recover more slowly. So these patients, again, if they're not getting better and they're not realising their health benefits, they're more likely to access health and social care services more frequently. So again, there's a knock-on effect to the wider healthcare economy there, knock-on to waiting lists, that kind of thing. There's the potential for over-prescribing, so potentially more medicines are prescribed or higher doses, because if the GP is not aware that the patient isn't taking their medicine as they had intended, the GP might give a higher dose, give an extra medicine. So there's lots of things that happen as a result of people not taking their medicine in the way in which it was intended. And also we do need to think about the carbon footprint of all this waste as well. The NHS is one of the biggest contributors to carbon footprint, and medicines are a large part of that. Now, if you're taking your medicine in the way in which it was prescribed, that's absolutely fine. But if you're not, and there's a lot of waste being generated, then that's contributing unnecessarily to the carbon footprint. And again, if people are not realising their sort of health benefits, it may be that they lose their independence and they're not able to continue to live at home. So there's a huge knock-on effects to all of this. My screen has stopped working. I can't move on. Hang on. There we go. So the objectives really of Your Medicines, Your Health, but again, we'll look to kind of refresh these and make sure they're fit for purpose, is really to raise awareness of knowing why you're taking your medicine, you know, what you're taking it for, and how you should be taking it. To encourage discussion with your prescriber or healthcare professional regarding the risks of not taking your medicine, or to be honest with your prescriber about the fact that maybe you forget to take your medicine, or you can't take your medicine because you can't access it from the packaging, or you don't like taking it because you're experiencing side effects. It's just really important to have those honest and open conversations with your healthcare professional about your medicine, because they're there to support you and for you to get the most out of your medicines. And they can only do that if they know the realities of what you're doing with your medicine. And really just to encourage everyone to care about their medicines, and for them to encourage their friends and family to also care about their medicines and the way in which they take them. So the key messages are to know what medicines you're taking, to know why you're taking them, know when to take them and how to take them, to know what to do if you're unable to take them, and again, to know what to do if you don't want to take your medicines. And if you don't want to, that's fine. But again, have those conversations with your healthcare professional rather than just stopping it, building up a stockpile and not telling anybody.